So, a ventricular septal defect is actually one of the more common congenital heart defects, and in most cases, they're really easily diagnosed and really easily treated successfully with little to no complications. So, basically, what it is, a ventricular septal defect, is there are four chambers of the heart. On top, there are the two atria, the left and the right, and on the bottom, there's the ventricles, which is also the left and the right. In this case, with a VSD or a ventricular septal defect, there's a hole between the two ventricles in the heart, which causes something that we call a shunt, which causes the oxygenated blood to flow to the deoxygenated blood. So basically what's happening is this oxygen-rich blood mixes with the oxygen-poor blood in the heart, and it goes to the lungs. So essentially, there's like a problem with just oxygenation in general. Typically, the signs and symptoms displayed by the child, it depends on the size of the hole. So whether it causes any signs or symptoms, it depends on the size of the hole and its location. Sometimes smaller VSDs, they honestly don't cause much at all, but if they're larger or they haven't been treated in childhood, they may cause more noticeable symptoms. So some babies may have faster breathing and they may get tired out really easily due to the lack of good oxygenation within the body. You may even experience them having a harder time feeding as well, and they may get tired while they're eating, while they're drinking from their little bottles. Also, they may be really irritable with feeding, and they may have a slower growth rate, so they may gain weight at a slower rate. So typically, like I said before, VSDs are really easily treated, and they're usually found in the first few weeks of life during the doctor's checkup. What we do is we hear usually a murmur as the blood passes between the left and the right ventricles. In most kids, small defects usually resolve on their own without surgery, but sometimes they may need it because when they grow older, it may get larger. Kids with smaller VSDs don't need to restrict their activities at all, but kids with medium to large VSDs may likely take prescription medications to help with that circulation in the heart and just help the heart just work more efficiently. Some other treatments, sometimes there's an option for heart surgery if the hole is really, really large, and that's usually done within the first few weeks to months of the child's life. Another thing that we can do is a cardiac cath. So cardiac catheterization, it may be closed with that. So that's when a thin flexible tube is inserted into a blood vessel that leads to the heart. And so it's positioned into the hole of the septum, and it's designed to just flatten against the septum on both sides to properly close that hole and seal that defect. But other than that, we're going to do our best to help your child with this VSD. Do you have any questions at all while I'm here? No? Okay, perfect. Thank you. Nice talking to you.